This clip is really an implementation clip, and that is what is the experience in similar fields that we could utilize to begin to gather data about how we can implement some of the discussions and data acquisition tools to gather the evidence in these kids with BPD.
There is a process, Steve, that we just used through the CF Foundation to try to deal with this group of kids who have sort of borderline sweat tests and do they have CF or not have CF. And so I've just learned about this Delphi process. I don't know if anyone else has experience with it, where when you don't have evidence-based medicine on which to try to develop care practice guidelines, there is a scientific method for getting a consensus. And so you administer, and you can do it with SurveyMonkey and identify a group of experts and develop a list of questions and do repeated cycles of the questionnaire where you take the input and you keep modifying and honing in on what the consensus is. Once you get above, I think it's 80% consensus of the group, you accept that approach. What would you do in the setting of a baby with, whose CO2 was 100 on these ventilator settings, and, get an 80% consensus. Then you have sort of a starting point of where you are right now. It might not be the right answer, but it's what most people would agree on. And then you could set about developing questions, testing whether those are the right things to be doing.
So collect data, hopefully apples and apples, and begin to work on what people think with the lack of, well, welcome to neonatology, but with the lack of evidence-based medicine, how do we begin to frame something that is close to as we can get, and then look and see if it changes the outcome with the idea. It sounds like within that model you're flexible to changes as they stare you in the face.
That's what the SCAMP thing that Jim Locke and the cardiologists in Boston are pursuing in many different heart lesions, and I think that's a nice
an
model.
algorithm kind of thing, or what?
Sort of algorithm, but again, it's not a, there's sort of shades, there are 3 shades of gray, I guess. There are 3 different, priorities, and that's where the consensus group would come up. What do you feel is absolutely essential? What do you think is stuff that most centers would want to do? And then what stuff are things that we should track that we might do different from center to center? And that could be in a variety of either diagnostic or therapeutic approaches, whether it's drug or event strategy management issues or diagnostics as well.